Hello friends, welcome back to my channel Medicine of 101. Today we'll talk about Zollinger-Ellison syndrome. So before starting the topic, let's see what type of the thing we'll see in these cases. So basically we'll get a tumor that is known as gastrinoma in these cases, and the most common site for this type of the tumor were within the duodenum. Okay. So basically if we talk in this disease, that we'll get the tumor that is known as gastrinoma. So gastrinoma. Okay, and the most common site for this thing, most common site where we'll see the tumor, we'll get duodenum first. Okay, let's use this color. First we'll get the duodenum, followed by we'll get where? Within the pancreas, followed by we can get within the stomach. What do you know in terms of the gastrinoma? Basically they will release the hormone that is known as what? Gastrin. So see, it will release the gastrin, and what it will do, the gastrin that will activate the what? Parietal cells of the stomach. So as we know, it will activate the parietal cells, and it will release what? More amount of the acid. It will release HCl. So whenever you are getting the acid productions in this case, try to understand. Okay, so the problem will be over here. Now what kind of the problems and what are the etiologies in these cases? Let's talk about those things. Okay, so I'll just give a clinical examples. For example, there is an young individuals. For example, you can say the male within 30 to 50 years old. In these cases, the individual is taking, he is having some problem. For example, he is having some epigastric pain. Okay, in these cases, okay, let's write it over here. He is having the, in these cases, we will get the epigastric pain, and for that thing, he is taking the what? PPI, the proton pump inhibitor. Okay, so for just to take the proton pump inhibitor, we don't need to have the what? The prescriptions from the doctor. We can just get it normally. Okay, so whenever he is using the proton pump inhibitor, see proton pump inhibitor, or we can say whatever the thing we'll see in these cases. Okay, see, acid productions in the Zollinger-Ellison syndrome, we also get the the ulcer where that is caused by the H. pylori. We also get the ulcers over here. We will also get the ulcers from here. But if you want to differentiate the ulcers that is caused by the H. pylori and the ulcers that we are getting over here for the Zollinger-Ellison syndrome for the gastrinoma development, how can I differentiate? See, in these cases, we will get a clinical features that is important over here. That is the diarrhea. We get the diarrhea over here, but we will not get the diarrhea in terms of the ulcers where we will get in terms of H. pylori. Okay. Now why we will see in these cases, as I said, we will get the more productions of the what? HCl. So see, in these cases we will get more productions of the acid, more acid secretion. So whenever we get the more acid secretions, the volume, if we say in terms of the volume, see the volume that will be more. Okay. Now see, whenever we are getting the acids, okay, definitely see this acid, there is chances for the acids. Okay, the pH will get the acidic pH over here, right? It is acidic pH, but there is chances for the acidic pH to go from the stomach to where? Within the small intestine. But whenever we will get this acid that will go from the small, stomach to the small intestine, at that time, whatever the problem we will see, we'll get what? Basically, we know within the small intestine, whatever the pH, there is the alkaline pH, right? We get the alkaline pH. But whenever we are getting this pH, that means the acidic pH is coming over here, and it is just making, the medium acidic. At that time, we will see the enzymes that will come from the pancreas, the different types of the enzymes. For example, pancreatic lipase, pancreatic amylase. Okay, so they break down the, for example, the sugars or the fats. So whenever we will get, for example, the enzymes that will come from the pancreas, for example, the pancreatic lipase, or if we talk in terms of this thing, we will get what? The pancreatic amylase. Now this type of the enzymes, they will be not functional. This acidic pH, whenever it will be where? Within the small intestine, they will inhibit these enzymes. Okay, so as a result, we'll get what? We'll get that sugar and fat unabsorbed. They will be not absorbed completely. Okay, so whenever these things will be unabsorbed, try to understand. This will be undigested. So whenever they will be undigested, that will lead to the diarrhea. Why will see the diarrhea? See, we will get the what? More amount of the carbohydrates over here. Whenever you are getting the more amount of the carbohydrate, the osmotic balance that will be not maintained properly, and that will lead to the diarrhea. Okay, so that will lead to the diarrhea over here. So that's the features we can we can just do the differentiations in among the what? H. pylori ulcer and the Zollinger-Ellison syndrome ulcers over here. Okay. Now let's talk about the other features. What are the other features we'll get over here? We'll get the GRD. We'll get also the GRD types. The symptoms we'll get over here. As you're talking in terms of the ulcers over here, what are the symptoms we got? In terms of GRD, we got the reflux disorders. Here we got, the retrointestinal pain. Okay. We can get the retrointestinal pain. We can get, nocturnal cough. Sometimes, that can cause the, problem within the voice box in the larynx. So we can get the, hoarseness of the voice. This type of, clinical manifestations we can get in terms of what? Zollinger-Ellison syndrome. I'm repeating once again. We'll get the gastric pain for that. For example, the individual is taking the PPA, proton pump inhibitor, or the antacids. As a result, we're getting over here, we'll get also the development of diarrhea. So why we'll see the development of the diarrhea? Whenever we're getting for the tumor development, we're getting the more productions of the acids. So whenever the more productions of the acid is over here, try to understand. They will release what? That will be sent from the stomach to the small intestine, and that will make the alkaline pH of the small intestine acidic. So within the acidic pH, these enzymes in terms of the pancreatic lipase or pancreatic amylase, they will be functionless. So these things will be not absorbed in terms of the sugar and fat. So that can lead to the diarrhea over here. Okay. Now when you are talking gastrinoma, along with this, we associated tumors along with this, and those are known as, okay, let's write these things over here. Multiple endocrine neoplasia type 1. Here we can get the different kinds of the tumor associated with the gastrinoma. We can see the development of this type of the tumor also. See, first we get the 3 tumors over here. We can get the pituitary tumor, that means the pituitary adenoma. We can get the pancreatic adenoma. Okay, so we'll get pituitary adenoma, we can get the pancreatic adenoma, and we can get also the parathyroid adenoma. Now try to understand from here. So when you are talking in terms of the parathyroid adenoma, that will release out more amount of the calcium. So whenever the more amount of the calcium that will be released, that can be responsible for, as we know from the physiology, that the calcium that can release, that can stimulate the productions of the acids. So here we get the more acid. Okay. So whenever the more acid will be there, this type of the clinical manifestations we can see. Along with that pancreatic, as we know, that can cause directly, I have already wrote it over here, that can develop the pancreas. So that will be responsible for development of the Zollinger-Ellison syndrome over here also. Okay, so this type of the things we can see in terms of the associations with the gastrinoma. We can get the pituitary adenoma, we can get the pancreatic adenoma, we can get the parathyroid adenoma. Now, in these cases, we have to ask the patients about that. If an individual, that means that we have to check the family history. We need to check whether the family history, any of the members, did they have developed before, for example, the kidney stones. If we see any kind of the kidney stone, then there is chances for the development of these things. Or you can ask the patient himself that whether he has this type of the problem appeared before or not. So we can say in terms of the past medical history. Okay, so you can just ask in terms of the family history, in terms of the renal stones, or you can ask in terms of the past medical history over here. Now, what type of the findings you can do over here, the investigations. So how can we just do the investigations over here? So for that thing, let's write it over here in terms of investigations. Okay. So if you say in terms of the investigations, here first things In terms of the investigations, we have to check that what the whether the tumor is present over here or not. Okay, for that thing we need to do upper GI endoscopy. We have to use what? Upper GI endoscopy. In upper GI endoscopy, we can find that whether there is multiple duodenal ulcers or the atypical ulcer. For example, we can get from here that multiple duodenal ulcers, duodenal ulcers, or if we say that in terms of the atypical means the positions that may be changed for it. Okay, so we can do the upper GI endoscopy first things over here. Okay, now let's see the other thing. As we know, in terms of the in terms of the if we get the ulcer for development or for the H. pylori. Okay, for that thing we can get what? If we just do the test for what? Breath urea test, we'll get positive in terms of the H. pylori. But here the breath urea test that is supposed to be negative. Just to eliminate, they can get the confirmation, yes, the individual is suffering from Zollinger-Ellison syndrome. So you can write it over here that breath, okay, urea test, that should be negative. Along with that, the urease, that should be also negative over here. Okay. Along with that, we can just do the PTH assay. That means we can check the parathyroid. Okay, parathyroid glands over here. We can just do response that whether there is a development of the tumor for it. If we get the parathyroid tumor, that can also leads to the more productions of the acid, and we can see this type of the manifestations. That's why you can also do the PTH assay over here. Okay. Now, we have done all these things, but if I say the investigations of the choice from the PTH assay, we can just check the calcium level, whether it is hypercalciuria for these things or not. But if I say the investigations of the choice, investigation of choice in terms of try to understand Zollinger-Ellison syndrome, what will be that? That will be the secrete study. So if you just check the secretin, then we can confirm it more clearly. So that will be the secretin. So by these things we can just do the investigation. In terms of we can do the upper GI endoscopy. We have to make sure that with that breath urea test that is negative, along with that urease that should be also negative. We can also check the parathyroid assay from here because it is also responsible for causing more amount of the calciums. So that calcium can leads to the Zollinger-Ellison syndrome. So we have to make sure these things first. Now another thing that we can use, okay, fasting gastrin level. Normally, what do you know that whenever try to understand whenever we're eating something at the time of the gastrin level that will be increased. But in this case, to see whenever in the fasting conditions the gastrin level that will be higher also, and we can say in these cases that will be, for example, 10 times than the normal level. For example, if we get over here 100, then in this case it will be 1000, for example. Okay, so we can also do the fasting gastrin level also. We can check over here just to confirm these things. Okay, and whenever I said these things over here, whenever the ACS they will come over here within the small intestine, and whenever they will come within the small intestine, they will cause the problem. We will feel the pain, gastric pain over here. But whenever the individual they will stop eating at the time the pain, the individual will feel better. Why? Whenever he stop eating at that time, the gastrin that will be not released. So whenever the gastrin will be not released, definitely the ACL that will not come from there. So we can just see in these cases, yes, the individual will feel relief over here whenever the individual will stop eating. Okay. Now we'll talk about in terms of the other things, in terms of the investigations. Now we can just do the localizations of the tumor. If I want to find out on the examinations the localizations of the tumor first. On investigations, if we check the localizations of the tumor, what do you know? In these cases, we will get a Zollinger-Ellison triangle. How we will get it? Let's draw this first thing. Okay. So, for example, is the gallbladder. Get what the cystic duct. Okay. And from here we get the hepatic duct that will come from here. So, common hepatic duct is the common hepatic duct we are getting over here. And for example, I'm just taking that we are getting the, we're getting the duodenal part over here. The duodenal first part, second part, third part. For example, is the D1, the D2, is the D3. D1, D2 and D3 over here. And what we get over here, the pancreas. We get over the pancreas. For example, is the head part, is the body part, is the tail part. Now whatever the triangle we get over here, try to understand with the different color. See, we will get, if we just draw this line from here, if we just draw, that will go through the head and body of the pancreas. If you draw the line from here, guys. Okay. And for that thing, let's erase some portions from here. I think that will be easier for you to understand then. Then it is coming in these directions, and we will get, for example, in these directions another. Now see, this triangle we are getting over here, that is known as the Zollinger-Ellison triangle. Is the JDS Zollinger-Ellison triangle. Now in these cases we can get the tumors. The tumor may develop where within these regions, but the size of the tumor normally it is so small that cannot be found. Okay, using this the different kinds of ultrasounds. So if we just want to make sure that whether actually the localizations of the tumor, we can consider in terms of the what? Zollinger-Ellison triangle. Here the tumor may be existed over here, or in the second part it's very rare. Okay, you can get also over here. The tumor we can see also within this pancreas as well. In these cases we need to do what? Endoscopy. Okay, or you can just do the ultrasound. We can do the ultrasound also. Okay, now in terms of the treatment, we got this type of things. Now, how can we just do the treatment for Zollinger-Ellison syndrome? As we are getting over here, try to understand as we are getting over here in terms of the Zollinger-Ellison syndrome, that definitely there is the ulcers. So, what kind of the drugs we are supposed to use over here? Definitely, we have to use the PPI, a drug of choice in this cases, for ulcer healing. For the healing of the ulcer, we have to use the PPI. That means in terms of the proton pump inhibitor. Okay, for the ulcer healing of the ulcer, we have to use these things. Okay, now we can use another kind of the drugs. I have to give through the injections, injected route through the you can use intravenous. What is the name of these drugs over here? You can use lanreotide. Through injections. Okay, we can use. Now I think we have heard already that octreotide. Now there is a derivative. This is the derivative of the octreotide. Now in these cases we have to use the lanreotide through the injections. Now what it will do, it will just what? It will remove the symptoms. For example, when basically in terms of the Zollinger-Ellison syndrome, we'll get the different kinds of the pains over here. So definitely in these cases we have to remember that these injections that will remove the symptoms. Now, if we get, for example, the last things we can do the surgery over here. Now, when we do the surgery, normally the size of this tumor very less. But if we get, try to understand, if we get the size of the tumor more than 1.5 to 2 centimeter, at that time we are supposed to go for the surgery. So whenever we will go for the surgery, if we see the size of the tumor, okay, more than 1.5 to 2 centimeter, at that time we can go for the surgery. Okay, that's the thing. Now sometimes we can see these tumors, okay, that can, by the metastatic process, that can go from these portions to the liver. From here to that can go to the liver, and that can cause a problem with metastasis in the liver. So for that thing, okay, let's write it over here. I think so that can cause within the liver metastasis, and in these cases, when the metastasis over here within the liver, we can just within the OH part, that means within the terminal portions of the liver, we can get this type of thing. So in these cases, we can also do the surgery in terms of the liver OH rejections. Liver OH rejections. Okay, in terms of these things. Okay, so this was all about in terms of the Zollinger-Ellison syndrome. What are the etiologies and what are the investigations you can do over here, and what are the treatment you can do. Okay. Now in the next video we'll talk about in details about the gastric ulcers. Okay. And one thing you can remember, this Zollinger-Ellison syndrome, the tumor we are getting over here, that can be seen where within the duodenum, it can be seen within the pancreas, within the stomach, or sometimes this tumor that can be seen within the ovary also. Yes, there is no fine telling we can get the tumor where within the ovary sometimes. So just remember these points. And the next video see you soon about the gastric ulcers, and I'll talk in details about those things. If you think this video is helpful for you, please do like and subscribe, and see you in the next video. Keep watching.